So,
Right.
what I like to do is I like to define trauma as such. Trauma is something that has negatively happened to you that leaves a negative impact that's lasts for a long period of time. So, that could mean you stubbing your toe really, really hurts, but that might not constitute trauma.
Welcome to Candid Minds with Dr. T. I'm Dr. Tamir Aldad, addiction psychiatrist and CEO of Mindful Care, the first ever psychiatric urgent care committed to providing affordable and accessible mental health care. Thank you for joining us. I'm Dr. Tamir Aldad, an addiction psychiatrist and the CEO of a psychiatric urgent care chain here in the US. Today, we're going to be discussing trauma. And traumatic experiences impact women's mental health in various ways, harming emotional, psychological, and physical well being. These symptoms can result from physical and sexual assault, domestic violence, childhood abuse, or other discerning events in one's life. The stress and emotional pain associated with traumatic experiences can lead to persistent feelings of sadness, hopelessness, helplessness, worthlessness, and fear. And survivors of trauma often experience hypervigilance, constant worry, self esteem issues, body image issues, feelings of guilt, shame, and ton of emotions that they try to navigate and find very challenging. Eventually, if left untreated, this can develop into serious mental health issues, PTSD, depression, anxiety, and panic disorder. To put it into perspective, about 8% of American women will develop PTSD at some point in their life, and women are about twice as likely to experience PTSD as men. This is in part due to the types of traumatic events that women are more likely to experience, such as sexual assault. Now, we see that what happens is there's a lot of shame associated with experiencing trauma. And more often than not, it takes a long time for individuals that experience trauma to feel comfortable enough to share it and talk about it. In that time, when they're not dealing with it or talking about it, they can engage in substance use and self injurious behavior or self harm. What happens there is individuals realize that they're having symptoms and they explore how they could medicate themselves or treat themselves to deal with them. So it could be alcohol use, it could be pain medication, it could be other drugs. And when they do that, there are moments of relief. And what happens to this individual is they realize that those few seconds or few minutes or few hours of relief are worth the risk of using that substance or consuming that alcohol. And their ability to make decisions are impacted because the pain from the trauma is so great. It's the same logic for self injurious behavior or self harm. Individuals that cut themselves realize that it's painful, but they have a few seconds of relief, and that those few seconds are worth the pain that they'll have after or the stitches that they'll have to get because there's this constant battle to escape the whirlpool of emotions that trauma leaves. And navigating that whirlpool is very difficult without seeking professional help. So, trauma can impact survivors' ability to trust and connect with others. And crossing that chasm is very, very difficult, especially if the way the individual was dealing with the trauma was by setting boundaries and dissociating and not being present. So, suddenly being present and trusting someone else and connecting with someone else goes against all the defense mechanisms that they fought very hard to develop. Also, fear of judgment and social stigma negatively impacts how trauma patients are able to come forward. We haven't done a very good job as a society embracing individuals that have experienced trauma, and therefore, we discourage survivors from sharing their stories and seeking help. And we need to do a better job at encouraging them to come forward and know that it's okay and know that it's safe. And I think we're getting better, and I do think awareness is improving, but I still believe there's a long way to go. My guest today is Maddie Spears. Maddie is a licensed clinical social worker and practicing clinician with a specialization in trauma. She's also a content creator and mental health advocate with a huge social media following, especially on TikTok. She's doing great work to bring more awareness to mental health issues, which is something I'm obviously very passionate about. And I'm excited to have her here today to share with us a little bit about her work, what she does, and hear her perspective. So let's get right to it, and we'll hear my conversation with Maddie now. All right. Thank you for joining us. We have with us today Maddie Spear, who is a licensed clinical social worker with extra training in trauma and also a content creator focusing on trauma awareness. And she does excellent work. We're very excited to have her with us today. We're going to be discussing a little bit about her experience, what she sees on the ground with her work and her advocacy, if there's any changes across generations, and how people are feeling dealing with their trauma, and then hearing her opinion overall as to where we're going and what she recommends people to do if they identify or know someone who identifies with traumatic experiences. So, Maddie, welcome to the show. Thanks for joining us.
Oh, I'm so honored to be here. Thanks so much for having me. I'm excited.
Absolutely. Share with us a little bit about your background. What is it that you do?
Yes, so I am a licensed clinical social worker, and I've been in the social work field for goodness, 6, 7, 8 years, depending on how you defined social worker in what context. But I've been doing this kind of work throughout most of my life. I developed a passion when I was pretty young, around 13, of wanting to help others and didn't quite know what that could look like. So it has been my life mission for the past 15 or so years to assist others in ways I can. That included getting trained as a social worker, working internationally with refugees, human trafficking victims, foster care individuals. And most recently, in the past 3 years, I created my own private practice here in North Carolina, where I specialize in helping individuals who've experienced trauma, hard life transitions, and anxiety between kids, teens, and young adults to help them navigate all the things that interfere with life in that.
That's amazing, and you've accomplished so much in such little time. Share with our viewers a little bit what additional training in trauma means for a therapist.
Yeah, great question. So additional trauma and training, training and trauma can look like a few different things. So that can mean more specialized training modalities such as EMDR and TFCBT, two of which I have experience and trainings within and certifications in as well. But it also can mean doing a lot more research. Evidence-informed practices are really deeply important with trauma-informed care. So that included a lot of the research I've done for my own practice and in my schooling has been heavily trauma focused. It also means the populations I've served and worked with actually all have trauma lines within them. I didn't
Mm,
realize that until I'd been doing the work for quite a number of years to that point. When I
sure.
looked back and thought, what was the theme of all of this? And realized, oh, I really like working with people who've experienced trauma. And from there,
Absolutely.
that's what I went into.
The For sure, and that impact is huge, right? If someone has
Mm.
dealt with trauma, it's so liberating when you're able to help them break down the barriers that they've spent so many years building, and putting up. That there's a lot of gratification with the work. One thing I've noticed though is the word trauma is thrown around a lot on social media. Everyone says, "I've experienced trauma. I have trauma I've never dealt with. I had a traumatic childhood." But it's unclear what that even means. I think everyone uses it differently. Curious from your perspective, what really constitutes trauma?
This is one of my favorite questions to ever answer. So I'm really glad you asked it because you're right. Social media is great for normalizing trauma, but we've almost normalized it a little too much where
Exactly.
now trauma is everything and anything at all times. And so
Right.
what I like to do is I like to define trauma as such. Trauma is something that has negatively happened to you that leaves a negative impact that's lasts for a long period of time. So that could mean you stubbing your toe really, really hurts, but that might not constitute trauma. Whereas getting into a car accident might be traumatic for you because it leaves this negative impact for a long period of time. I also want to preface not every event equals trauma. Everyone has a different interpretation of trauma based off of their upbringing, their adverse life experiences, and other things that have gone on with them. So just because one thing that may have happened to you that wasn't traumatic doesn't mean that it is not traumatic for someone else. So that's why trauma kind of has to have a loose definition, but I'm a little bit worried it's getting a little bit too loose, that it's
Yeah.
invalidating some other people's experiences with trauma too.
Absolutely. And I've actually noticed culturally too that the level of resilience is different depending on where you're from. People make that joke that it's a first world problem. But they're only half kidding because there's things here that we would consider traumatic, but then when you look elsewhere in the world, they wish those were their problems, right? And that's juxtaposing those two. I think it's important to realize that depending on where you are, your priorities are different, your perception of trauma is different, your resilience is also very different. We've been spoiled in many ways here. So if something is taken away, it's difficult for us to compensate, whereas elsewhere they're much quicker to compensate, right? So really having that perspective is important. Do you think generationally as well, not just culturally, there's differences in trauma if you're comparing, let's say, millennials to Gen X or Gen Z?
I think the generational component is such an interesting one to also get into because I don't necessarily know the difference in terms of how trauma impacts someone, but in terms of the ability to express the trauma, yes, that is vastly different. People who are maybe older generations have been taught trauma is not something you discuss. You push
Right.
that down. You do not admit that you have something going on. Whereas Gen Z and Gen Alpha are like, woo, look at all the things I have. Let me give you my therapist PowerPoint where I can share with you all the
Totally.
trauma I've
Right.
experienced in my life. All the 10 years of my life, here's every breakdown of all the trauma things that we've had,
Mhm.
which is both a really beautiful thing and that I sometimes wish older generations would adopt. But it's also hard for us to know exactly the levels of you know, resiliency with a lot of these things because we're also seeing older generations have different issues that have come out of not processing long-term generational trauma and issues that have come up. I think you bring up an interesting cultural point too. I do think culture also has a very profound point even when talking about generational things as well. I was actually in Thailand a couple months ago and visiting an organization I used to work with that worked with individuals who were based in human trafficking, who had been refugeed, who had been orphans, the whole 9 yards. And there was this little girl I was speaking to, and she just started to speak her whole life story just because people were asking her questions, and very, very traumatic things had happened to her. And I, of course, am happy to share, but I'm not going to for the sake of, privacy and um, viewers' discretion. But what I can say is that exactly what you said earlier, her resiliency I have found to be much more profound than typical individuals, maybe more her age now. The resiliency of her sharing that might be more than what someone her age might be experiencing now in, let's
Yeah.
say, the society that I currently live in. However, it is interesting how much more people who are in my society can be impacted by, let's say, quote unquote, smaller things. Now, I don't want to diminish or demean anything that somebody is going through, but just the comparison of those two cultures alone is a really profound thing to take a look at.
Or one thing I always fear though with young people sharing their trauma is re-traumatization, right? And and
Mhm.
and, and reliving what they experienced. And we sometimes see this unintentionally, like when the police come to the emergency room with sexual violence and ask someone to recount the entire event for the sake of their investigation. I always fear that that actually is worse for the patient, having to relive everything they just experienced without giving them the right time to grieve and process. So, sharing is also it's a slippery slope as to when it's appropriate, when it's not, and if it can have negative consequences on the person's recovery and healing. So certainly need to tread there lightly. But what's interesting is I think for our listeners, we're talking about different cultures, we're talking about different generations. We're talking about how the trauma is really for you to define if it was traumatic or not, right? No one else can tell you if stubbing your toe was incredibly traumatic for you. No one else can really tell you that it wasn't if it really was, and if it's paralyzed you because all you do is think about it. When do you think it's appropriate for someone to see a therapist and recognize that it's something that needs to be addressed versus them not being resilient enough or them not being able to tolerate enough? How do they know when is the right time?
What a beautiful question. And I think the simplest way I can answer that is when you start asking yourself that question, it's probably time. If you're asking, is this bad enough? Is this a problem enough? I just don't know. If you're not sure, you're probably ready to see a therapist. Because at that point, what I'm hearing is you're saying, I don't know if what's going on with me is quote unquote normal, if I can just tough it out myself, or if
Right.
I could use extra supports. And I think everyone deserves extra supports. And that can lead into a whole other conversation of, limiting factors, whether or not you're able to access, whether or not you believe you deserve to access, that's a whole other conversation too. But the simplest way I can put it is if you're starting to feel that way and you're starting
Yeah.
to notice that these symptoms linger, it doesn't feel like you used to feel. It feels like things are impacting you more. You are worthy of seeking help, and it is there waiting for you.
Yeah. No, I completely agree. And I think the benefit outweighs the risk. It's unusual for you to go and to therapy or seek help and then it to feel worse. So I think just exploring that and seeing if it's the right time just trying it will help you make that decision. So I completely agree. And you're doing all this great work. You're seeing what's going on the ground here and internationally with all the organizations that you're a part of and your travels. What do you think the future of trauma work looks like?
I can tell you what my hope is for the future of trauma work. Whether or not people actually listen to me is another story. But
Mm,
my hope for the trauma work field is that it continues to become way more inclusive than it has been. And what I mean by that is not just certain people groups or certain atmospheres, but more inclusive of everyone being on board with what trauma informed care means. For example, you brought up someone who has experienced assault retelling their story to a police individual who's having to, recount it for a court case. Well, oftentimes individuals who are, reading these stories or taking notes from someone's case don't, aren't trained in trauma work. They're not
right.
inclusive in the way that they understand how it's being received. And you made an interesting point. I'm going to butcher the words a little bit, but it's something along the lines of, it might be harder for people to tell their story, it might be re-traumatizing. Well, it's not actually re-traumatizing for people to tell the story. It's re-traumatizing to see and hear the reactions of people who are listening to
Yeah.
the story and not receiving it the right way. So in the
Right.
future of trauma work, my goodness, I wish it was more inclusive of the individuals who need to realize they're a part of this trauma-informed care, whether they realize it or not, and more
Sure.
training, more accessibility for people. I think all of those things would be profound in the trauma world.
Yeah. Yeah. There's almost a lack of sensitivity sometimes,
Mm,
and greater sensitivity, awareness, empathy, um, validation.
mm,
Right. I think people are even just validating somebody when they share their story goes a long way. Where people try to be helpful, but they could be more damaging sometimes, and it's a slippery slope there as well. So I completely agree. You're doing excellent work. I salute you for your effort and being such a strong advocate for trauma informed care. Thank you for all the excellent advice you shared with me and our listeners. I appreciated. I know you're very busy, so I appreciate you taking some time to be with us today, and look forward to having you again on the show sometime in the future.
thank you so much. This was so lovely. And to any listeners who are listening and wondering kind of what to do, seek therapy. Hope they can get that from this episode is therapy's worth it. You're worth it time and time again. So thank you for having me. I appreciate it.
Absolutely. Thank you. What a great conversation. It was nice to have Maddie join me today to share her perspective on trauma care as a practicing clinician, and I enjoyed learning her perspective and her views. I think she was spot on on her analysis of when it's time to seek treatment. If you've been through something difficult or asking yourself if you need professional help to recover or you know someone in a similar situation, then it's probably time to reach out to a mental health professional. When doing so, it's important to find someone that you identify with, can establish rapport with, and what we call a therapeutic alliance, which means you're prepared to do the work, be honest, be truthful, be forthcoming, and slowly develop the trust necessary to reach that point of healing. If you can, try to find someone who specializes in trauma work. There are many therapy modalities that are specific to trauma, particularly EMDR. Not all therapists will have that level of training, but it's important to at least try and find someone who has worked with patients that have experienced trauma and is able to understand your perspective and offer you the tools to overcome obstacles and barriers to achieve recovery. I'd also want to recommend a book. There's a very popular book called The Body Keeps Score. Many of my patients have read it. Colleagues have sworn by it. I've read excerpts myself and think it's an excellent piece of work. Highly recommend if you've experienced trauma of some sort that you read it, as I think it will be very helpful and insightful. Thank you for joining us. I enjoyed today's conversation. Thank you, Maddie, for being here today, and look forward to seeing you all again soon. Thank you for listening. Please follow us or subscribe wherever you get your podcasts. Please follow us at Mindful Care and at TikTok Psychiatrist for more, and don't forget to rate and review.